all permission from all of you, we would like to record this meeting for our record purpose. So through Global Learning Collaborative Secretariat and through members management team, we are in touch with most of the members earlier as well. But I think this is the first time where we are trying to get all of you together and trying to explain what are the objectives of this collaborative and how we are going to take this collaborative forward, and what will be the procedure for learning, and what are the journeys and what are the benefits available those who have accepted the membership for this particular collaborative. To give you an update, till date we have onboarded around 25 members and 10 technical advisors on this particular collaborative from 8 different countries. So we thought just to have a networking meeting so that every member should know who all have joined this particular collaborative. And to start this particular meeting, let's have a round of introduction to know each other briefly, because due to time constraint, maybe we may not have time to discuss in detail who is who and what all work we are doing in and around the health system resilience work. So I would like to call the members here who are attending this meeting for the brief introduction. You can give detail about yourself, your organization, and maybe the work you are currently doing on health system resilience, or in the past you have worked on health system resilience, along with the broader expectations from this particular collaborative. I'll just like to invite Dr. Vijay L. Dandi for brief introduction, please.
Hi, I'm an infectious disease clinician, and I head Share India, which is an organization that provides technical support to the government of India in a variety of areas, focusing primarily on infectious diseases, HIV, tuberculosis, COVID, infection prevention and control. So we work in several different areas. So one is laboratory quality management systems. The other is HIV treatment, tuberculosis prevention and treatment, particularly drug-resistant tuberculosis, and infection prevention and control. Yeah, we have other areas of interest too, but this is the primary focus. And as a clinician, I also take care of patients who have complex problems, primarily arising out of immunodeficiency. So.
Yeah. Thank you, sir. Thank you for the introduction. Dr. Angela Chaudhary.
Hi, good evening. My name is Dr. Angela Chaudhary. I'm from the Catalyst Group representing Catalyst and Swasti. We work for the health and well-being of some of the most marginalized populations. We're headquartered here in Bangalore and work across 25 countries, mostly in South and Southeast Asia, and a little bit of East and Central Africa. We don't over-focus on any particular disease or condition, but it's more about people-centered health, therefore taking into account social determinants of health and how those dots join with specific vulnerabilities of marginalized population with those diseases, conditions, and matters that affect them. We also work, and so therefore we're talking about health equity, and another pillar of our work is health system strengthening. So how can community systems be strengthened so that health systems come closer to them? Is our approach to work. So we have 3 approaches: demonstration, which is working directly with communities; support to scale, that is providing technical support to other organizations, be they civil society, academia, resource organizations, UN organizations, or technical organizations; and the evidence to influence pathways, so research for the sake of program design as well as policy influence. Thank you for having me here.
Thank you, Dr. Angela. Dr. Achisman.
Hi, I'm Achisman Mahapatra. I'm based out of Noida. I'm a public health researcher and I represent a nonprofit called Grid Council that does multi-site epidemiological studies and public health studies. So we work primarily on 3 different fronts. One is a collaborative effort that we do with medical colleges. So we write multi-institutional co-authored papers relevant to policy, and health system strengthening. The second dimension is we work closely with development partners, trying to make sense of the data that they collect so that we write briefs and papers, which can be communicated as policy translation material. And the third one is capacity building in the form of webinars. We take up very pertinent topics relevant to health system strengthening. And that's what we do. And we also design courses around that. So that's what we do. We operate primarily in India, and we focus on priority public health problems. So we have 6 domains, but then you can call us as a cross-cutting organization. Thank you. Very happy to be a part of this collaboration. Thank you, Srikanth, and thank you, Dr. Girish, for inviting us. Thank you.
Thank you, Archisman. Dr. Subodh, please.
Thank you, Dr. Srikanth. This is Dr. Subodh. I head the Dr. Kakarla Subbarao Center for Healthcare Management at Administrative Staff College of India. So we are a sort of an autonomous institute under the central government located at. In ASCII, we do a lot of activities related to research, training, and consulting. So predominantly, most of our work are mostly on evaluations of existing healthcare programs and strengthening primary healthcare. But we also have other areas like urban health, rural development, and so that there is sort of a cross learning across departments. It's a pleasure being here and happy to contribute. Thank you.
Thanks for joining, Dr. Subodh. Dr. Sunil Kumar Joshi.
Okay. Hello. Hello and namaste to all. So I'm Dr. Sunil Kumar Joshi. I'm from Kathmandu Medical College in Kathmandu. It is affiliated to Kathmandu University, and I'm working here as professor and head of the Department of Community Medicine. So basically, we are here working with various research projects, and Kathmandu Medical College has extensive research collaboration with many universities around the world. So basically, I'm here working on occupational health and safety. So I'm the first occupational health physician, and I have been working in this field for last 22 years, starting from scratch up to the different policies on occupational medicine, occupational diseases, and injuries. Then we are working on different policy level research activities on injury prevention in Nepal. So I'm also heading Nepal Injury Research Center, which is NIHR funded program. So we are working very closely with the government of Nepal, WHO, and other international organizations. So similarly, we're developing different courses on public health and community medicine, and producing many MD and PhD in public health related subjects. So this is really my privilege and honor to work with all of you. So I think it's a very good platform for me to learn something new and to share experience and to work more effectively in this field in future as well. So thank you very much for this opportunity.
Thank you. Thank you, Dr. Sunil, for joining. Dr. Ajit Kumar.
Yeah, good afternoon, everybody. Sorry for joining late. So I'm Dr. Ajit, and I'm the director programs for an urban health project called Samagra, funded by USAID, led by Population Services International. So we're currently working across 6 cities, and in the process of adding more cities as well. So the focus is on health system strengthening and providing comprehensive primary healthcare to the urban poor. So actually my career spans over 2 decades. Had the opportunity to also work with Access Health sometime in the past. And by training, I'm a pediatrician, but then I moved to community pediatrics and public health. Had the opportunity to work with UNICEF in different states in India. Also with a with a donor organization like the Bill Melinda Gates Foundation and with Access Health and Piramal Swasthya. So I really look forward to learn from everybody who's a part of this consortium. And I had the opportunity to lead a similar consortium for COVID-19 vaccination, which we are currently leading as well. And we are in the process of also developing a learning exchange initiative for urban health as well. So I think there would be a lot of opportunities to learn from each other and see how best we can contribute to strengthening health systems in India and beyond as well. So thank you so much.
Thank you, Dr. Ajit Kumar. Dr. Deepak, if you can introduce yourself.
Hi, good afternoon, everybody. This is Dr. Deepak Raut. I am presently working as a Director Professor and Dean Academics at the National Institute of Public Health Training and Research, which is a premier public health institute of Ministry of Health and Family Welfare, Government of India. I have more than 30 years of experience related to the teaching, training, and research in public health, epidemiology, biostatistics, and other communicable as well as the non-communicable diseases. Currently, we are running several courses in the health as well as the allied health sciences, including the Masters in the Public Health, then Postgraduate Diploma in Community Healthcare, Postgraduate Diploma in Hospital Management, Postgraduate Diploma in Health Promotion Education. Also, we have recently launched various skill-based training programs in our institute. And I'm basically a medical graduate with post-graduation in community medicine. It's my pleasure to be associated with the Global Learning Collaborative for Health System Resilience. Thank you very much.
Thank you, Dr. Deepak. Dr. Dhananjay Mankar, can you please introduce?
Yeah, thank you, Dr. Shrikant. Yeah, I am Dr. Dhananjay Mankar from School of Health System Studies, TISS, that is Tata Institute of Social Sciences. I represent Center for Hospital Management. As you all know, School of Health System Study, being a part of TISS, it prepares students for a leadership role in public health and managerial roles in the field of health and hospital administration. The school has an active social research programs and national and international research collaborations in the area of health policy, health system strengthening, and public health contributions to the newer generation. And we have 3 diploma program as well as 4 master's program, and along with that we do offer doctoral research also. What important dimension for the school, what I represent is with the research activity and its contribution in making and developing understanding the health and healthcare as a social science. And the school is even quite responding and even in capacity building and knowledge management needed by the government particularly. And it even contributes to developing the newer and innovative healthcare strategies. It also provides advocacy support for public health and even building equity concerns into health policy and planning. Thank you.
Thank you, Dr. Dhananjay. May I request Professor Hussain Rahman to kindly introduce yourself?
Thank you, Dr. Shrikant. Hello, good afternoon, everyone. This is Hussain Zillur Rahman from Bangladesh, Dhaka. I'm Executive Chairman of an independent policy research center called Power and Participation Research Center. I am also the convener of a civil society platform called Healthy Bangladesh. I am also currently the chairperson of BRAC Bangladesh. I'm an economist by training, but we are very interested in the strategic agenda of health. In particular, we are focused on policy advocacy and also trying to get newer types of stakeholders into the involved in the overall health agenda, including, for example, city mayors and the schools. Those are the newer types of stakeholders whom we are trying to mobilize. And the Healthy Bangladesh agenda is focused on healthcare, but also the social determinants of healthcare. The sanitation agenda, the nutrition agenda, and the wellness agenda, all those together. We are also doing, we've been doing research on the out-of-pocket expense burden, basically the affordability agenda for healthcare, how to make that more sustainable. Yep, that's, and we do many other things, but I'm sure we will get to share all these as we move along. Thank you.
Sure, Professor Rahman. I would like to request now Professor Kea to introduce herself.
Hi, thanks, Dr. Shrikant. So good afternoon, everyone. My name is Kea Furtado. I'm Associate Professor at the Goa Institute of Management. So at GIM, we have a healthcare management program, and that's the program that I teach on. By training, I am trained in, have a master's in public health and a PhD in health sciences. And my work was primarily in developing a public-private disease surveillance system for infectious diseases. So this was work that that was very interesting to me at the time, and of course, COVID kind of made it evident that these were basic gaps that were still sort of still evident when COVID hit. Although my work now focuses more on overall health systems and health financing, this is an area that I'm still very interested in, and hopefully would like to continue to work on as part of this collaborative. So yeah, I think that's essentially the relevant bits of what I do for this forum. And otherwise, we have a healthcare management program that's cross-domain. We cover all the domains of healthcare, and my faculty colleagues as well. So we do consultancy, research, and teaching in different areas of public health and health systems. Thank you, and thanks for this opportunity.
Thank you, Dr. Kea. May I request now Dr. Lean to introduce, please? You're on mute.
Can you hear me now?
Yes, Dr. Lean.
Sorry. Okay, thank you so much. Good afternoon, everyone. I'm pleased to join this first meeting of GLC members. So I'm from China, from Shanghai. So currently, we are still on the lockdown of the COVID-19. So that's we're still at home. So I'm very happy that I can join this initiative. So I'm currently the general manager of the Wonder Information Group. So we are the digitalization company in China, provide the big data service for the government and especially for healthcare. So currently we specialize in the chronic disease and some like the hepatitis B, hypertension, and COVID-19, and also the heart disease, cancer. So we provide the service for the government and also the academic research centers. So we do a lot of research based on the big data, based on the data of all the cities and the provinces. So hopefully in this initiative, I want to learn with the peers and want to apply what's the success stories in other countries in China. Thank you.
Thank you, Dr. Lean. May I request now Dr. Rabin to introduce himself?
Thank you. My name is Sten Vermund. I am a pediatrician and infectious disease epidemiologist. I have served as dean of the Yale School of Public Health here at Yale University in New Haven, Connecticut. We're about 2 hours train ride north of New York City. We have a Department of Health Policy and Management many of whose members focus on health systems reform. We also have a global health leadership initiative, which does management and leadership training, largely in international settings. My own work has included HIV capacity building in Africa, where I've worked intensively in Zambia, Mozambique, and in Nigeria. I also worked in India, Bangladesh, and Pakistan, and I'm very pleased to join this, this group because I think the mission is quite vital. Thank you.
Thank you, Dr. Stein, for joining in and taking out time for this particular meeting. May I now invite Dr. Rabin Gautam to introduce himself.
Hello and good afternoon, everyone. This is Rabin Gautam from Nepal. By training, I'm a medical doctor with a community medicine background. And I currently work in WHO Health Emergencies Program within the epidemiology unit, where I'm supporting the government of Nepal in the surveillance related activities. My key areas that I currently work in is analysis of data for COVID-19 and supporting in some of the outbreaks that are detected in the country, as well as other surveillance related activities, such as developing guidelines documents related to surveillance, some of the research activities, particularly involved in the seroprevalence survey in Nepal, along with training related to surveillance activities that is being carried out in the country. Some of the things that I can contribute maybe is my own experience working in the surveillance program within the team, but at the same time also learn a lot of things from colleagues within the team in different areas that they've been mentioning. So that is all about me, and thank you for having me, and over to you.
Thank you, Dr. Rabin. Now I would like to request Dr. Rishabh Chopra from PATH.
Thanks, Shrikant. Sorry for the background noise. I'm traveling. I'm Rishabh Chopra. I lead strategy and partnerships for PATH in South Asia region. Been with PATH for about 8 years, and I have a MBA in strategy from ISB Hyderabad. Essentially, PATH is a 43-year-old organization headquartered in the US, but we have offices in 20 countries, and our work connects about 70 countries. In South Asia, we are active in Nepal, Bangladesh, Sri Lanka, and Myanmar. So good to see, and we have an office in China as well. So great to see colleagues from Bangladesh, Nepal, and China on this call. We focus on public health innovation, bringing it to demonstration and scale. And we are working with multiple disease control programs, the government of India at many states level, and figuring out how they can be reached to scale. We work with the private sector in the vaccine manufacturers and private providers in the healthcare space. And something that health system resilience, we've been working a lot in the COVID-19 response, supporting and improving oxygen delivery systems in 23 states of the country, and learning lessons from one state to the other. And the other piece is, of course, we've been working on many improving public health systems, as well as engaging with the private healthcare providers in urban cities across India. So looking forward to this innovative platform, contributing our learnings, and also seeing what lessons we can learn from all the other organizations that are present here. Thank you.
Thank you, Rishabh. I would like to invite Vaisya Krishna.
Good afternoon. My name is Vyasa Krishna. I am heading an insurance company currently in Kampala in Uganda. My specialization is health insurance. I studied and my doctoral research is in micro health insurance risk management. I have done earlier for the micro health insurance program for the Gates Foundation's project in India. And our current interest is health financing and providing healthcare finance facilities. How best we will be able to do it currently in Uganda. And I do consultancies for international financial institutions like World Bank and IFC on health insurance. So that is the brief background.
Thank you, Dr. Vyasakrishna. Now I would like to invite Professor Wu Xing.
Thanks. So my name is Wu Zhen. I'm an associate professor at Georgetown University in the Department of International Health. And my specialty is on health economics, health financing. I've been working on health financing for many years, particularly in developing countries. In Southeast Asia, I work in Afghanistan, Bangladesh, and as well as some work in India. Regarding health system resilience, currently I have several projects with World Bank. One is to really understand the health financing for health system resilience. And we work with them, submit the chapter on that and to the World Bank. Another piece of work is about the costing of the health system resilience. Resilience means many things. We really need to understand what are the key components to be included in the resilience as well as the preparedness. So for this forum, I think I'm very much interested in understanding the country's experience and activities on the resilience-related work and how to categorize a different type of work, and also hope that some of the tools that we're going to develop can be applied to the countries. Thank you.
Thank you, Dr. Wu. Now I would like to invite Professor Shamanna to introduce yourself, please.
Very much, Srikanth sir and Dr. Nardi. I'm extremely sorry that I had to join in a little late. I'm Shamanna. I work as a professor at the School of Medical Sciences, University of Hyderabad, and we have just executed a memorandum of understanding with Access Health, and very fortunate that I've been sort of guided, and we've been getting a lot of inputs, and we're trying to work together with Access Health and then the Global Learning Cooperative for Health System Resilience. I come from a public health background that run a MPH program as well as a PhD program with you. Thank you very much.
Thank you, Dr. Shamanna. Now I would like to request Mr. Santosh Sharma to introduce himself, please.
Hello, am I audible?
Yes, you're audible.
Okay, thank you. Good evening, everybody. I'm Santosh Sharma Paudel and work at Nepal Institute for Policy Research. Technically, my expertise is in the area of foreign policy. And since the pandemic, I think one issue that I have been looking at is the border issue between Nepal and India, which is practically open, and then the mobility of people and the impact it had in terms of spreading or in terms of the problem it created to control the pandemic in both cases. At my institute, besides that, we are primarily focused around the governance issues related to the pandemic at federal level, provincial level, and at local levels. Through this, I think we look to, learn more about the experiences in other countries, probably in countries which have more similar system, and then see what the implications are for Nepal. Thank you.
Thank you, Santosh. Now I would like to invite our team members from the GLC Secretariat to kindly introduce themselves briefly. I would like to first invite Dr. Reddy, please.
Yeah, thanks, Srikanth. I think some problem with the audio. Am I audible now?
Yes, sir, you're audible.
Thank you. Yeah, most of the members who have introduced are familiar, I think, know in person. Of course, some of the new members, invitation from Access Health. Introduce myself, I'm a cardiologist, currently the regional director for South Asia of Access Health International. I co-founded a chain of hospitals in India, it's 15 to 16 hospitals across 6 states. I also founded a medical device company after developing India's first coronary stent with the objective of making it affordable and self-reliant in technology. So this is a big background, but currently major focus is on health systems as part of Access Health activity. Thanks, Rika.
Thank you, Dr. Reddy. I would like to now invite Dr. Sejal to introduce herself, please.
Sejal is muted, I think.
Can you hear me now?
Yes, we can hear you now.
Okay. So thank you, Shrikant. Thank you, Dr. Reddy. It's a pleasure to meet everybody. I'm very excited for the discussions. I'm Sejal Mistry. I'm the Regional Director of Access Health for the Southeast Asia region. I have a background in policy with the US government, the Korean government, and I've been with Access Health for the last 5 years, focusing on health financing and also along the lines with health system strengthening. Thank you very much, Shrikant.
Thank you, Sejal, for this brief introduction. Now I would like to invite Mr. Maulik Chokshi.
Thanks, Shrikant. My name is Maulik Chokshi. I'm the Deputy Country Director India, leading the technical arm of Access Health. I'm a health economist and a health system expert, work across domains of financing, human resources, and pharmaceuticals. I work a lot on health system design. And in this particular endeavor, I will be looking at the knowledge management piece. And I have around 23 years of experience in health systems across various countries. Thank you.
Thank you, Maulik. Now I would like to invite Mr. Girish to introduce.
Hi, everyone. I'm Girish. So I come with a background in healthcare management, largely, and worked in both public and private healthcare in India and outside India. Come with more than 20 years of experience, and lastly work in the areas of healthcare provision, innovation, insurance products, design, and creating specific service delivery models to meet some of the issues which we have to solve. This largely been the work which have been there. Currently, as part of this program, I'm leading the members lead management, leading it, and I'm sure that we will have a much more discussions as we move forward. Welcome to all once.
Thank you, Girish, sir. Now I would like to invite Dr. Uma, please.
Good afternoon, evening, and morning to all the members who are present here, and a very warm welcome. I'm a Director of Communications, Relations and Partnerships at the Access Health International, and I engage with state and central government foundations, national and international industrial bodies, and multinational companies and technical institutions to mobilize resources, collaborate with, and provide actionable support towards the overall health vision of strengthening systems to secure health. I'm also part of the founding team of In Order, an associate of Access Health International, and I represent In Order today as I speak. I have 35 years as a healthcare professional and have worked across all the major areas of business and public-private partnerships and public health in these years. It is indeed a privilege to be here. Thank you.
Thank you, Dr. Uma. Now I would like to request Tina to introduce herself, please.
Hi, everyone. It's a pleasure to be here. Thank you, India team, for organizing, facilitating. I'm Tina. I'm the Director for Strategic Consulting and Impact Program based in the China office. My work has been mostly around the health system transformation and particularly health financing in China. But I look forward to learning from all of you through this membership. Thank you so much.
Thank you, Tina. Dr. Anuradha to introduce herself, please.
Good afternoon, everybody, and good morning, as Uma rightly said. I am Anuradha Katyal. I am the Technical Specialist Research at Access Health International. I am a dentist by training and a master's in healthcare management, and more recently, a master's in data science. Very passionate about quantitative research. And in this particular initiative, my role would be to translate the vision of the collaborative as a whole, especially our project lead, Dr. Reddy, our technical lead, Maulik, and most importantly, the members who are yourself and our technical facilitators into more discernible knowledge products. So I'll be taking up that work. Thank you so much, Shrikant. Over to you.
Thank you, Anuradha. Latika, if you can introduce yourself.
Hello, everyone. My name is Latika. I have recently joined Access Health International as a project manager for GLC4HSR. Welcome, everyone. Thanks.
Thank you, Latika. Evan Chang.
Hi, everyone. I'm Ivan, the Assistant Project Manager here at South International Southeast Asia's office. Very nice to meet all of you.
Thank you, Evan. Sushma.
Hello, everyone. My name is Sushma, and I am a public health researcher. And in GLC, I'm in knowledge management team, and I'll be working on surveillance and resilience thematic areas. Thank you, Shrikant. Over to you.
Thank you, Sushma. Chilshu. Dr. Chilshu, please.
Good evening, everyone. So I'm Dr. Chilshu, currently working as a program associate under the capacity building vertical of Access Health International. And with respect to GLC, I'll be working on the learning process, and glad to have you all here. Thank you so much, Dr. Shrikant. Over to you.
Thank you, Dr. Chilshu. Mehnaz.
Hello, everyone. I'm working as a public health researcher in knowledge management team, and looking forward to learn from you. Thank you.
Thank you, Mehnaz. Dr. Vinod.
Good evening, everyone. Dr. Vinod. I'm currently working as a consultant at Access Health International. I look after the grants and advisory opportunities for the organization, and I'm currently working with the members management team. So I'll be in constant touch with all of you with regard to all the member engagement activities. Thank you, Shrikant.
Thanks, Dr. Vinod. Stuti Shukla.
Everyone, this is Stuti Shukla. I'm currently the communications manager here at Access Health. I work in a team that's responsible for the strategic external and internal communications of both Access Health and the associate partner in order. It's lovely to meet you all and see such a wide geographic representation. Happy to be here. Thank you.
Thank you, Stuti. I think I have missed Dr. Manjunath from the members.
Yeah, 1 minute. Yeah, can you see me?
Yes, Dr. Manjunath, please.
Okay. Yeah, sorry, I've joined a bit late. I'm Dr. Manjunath Shankar. I'm a public health specialist. I've got more than 17 years of experience. I'm based in Delhi, and I look forward to contributing to the surveillance and the preparedness part of the GLC. Thank you.
Thank you, Dr. Manjunath. Have I missed anyone else? Okay, so lastly, I would like to introduce myself. I'm Dr. Shrikant, and I'm a trained epidemiologist and a public health professional, working in field of public health since last 10 years, and currently leading various initiatives of Access Health in capacity building and public health. Regarding Global Learning Collaborative, I'm part of both members management team as well as knowledge management team, with leads of which are being led by Maulik and Girish. and I would like to work more on the surveillance thematic area, and I'll be coordinating the whole surveillance theme with respect to the GLC initiative. Yeah, so this is about myself, and now I would like to hand it over to Dr. Krishna Reddy for introducing the whole collaborative and the road ahead. Over to you, Dr. Reddy.
Sir, we are unable to hear you.
Not able to hear you, sir.
No.
Now you're audible, sir.
Yeah. Yeah, sorry for this technical problem. So I will introduce GLC, I mean, why it came into existence and how we are attempting to organize this collaborative. What is its purpose? The purpose for which all of us as members have initiated this collaborative, and what will be the ultimate impact of this collaborative, what we would like to achieve as all of us together for this collaborative. So as the world is recovering gradually from the COVID pandemic, and every country, every system, every institution, they're trying to learn what happened during the pandemic, what worked well, what did not work well, what are the key systemic issues that influenced the good response or the bad response. Most of the developed countries have the institutional capacities to undertake this learning process in a very systematic fashion. The great universities, academic institutions, their own governmental institutions.
Sir, we lost your voice again. No, sir.
Hello.
Yes, you're audible now, sir.
Okay, I'll switch off my video. Then I think these technical problems may not come.
Sure, sir.
So as I was mentioning, most of the advanced nations have the privilege of having the institutional capacities to learn from what happened in the pandemic. In the global south, many countries may not have the institutional capacity. There may be pockets of excellence, but there may not be enough institutional capacities. There may not be enough resources to gather information, undertake research, and learn through these mechanisms. And COVID actually demonstrated the power of collaboration, especially in the science and technology space. It also demonstrated the perils of non-collaboration as countries became self-centered and self-interested. So given this background, I think there was a need for a learning of what happened during the pandemic from each other, between the countries of global south and the global north, and the global east and the global west, and also from the government functionaries as well as academicians, non-governmental academicians, the civil societies, and the researchers. So the whole idea was to, as the name implies, it's a global representation. So it is a small beginning in the first members meeting, but what we are hoping that it will spread across the world from different countries representing governments and the non-governments. So that is the in a collaborative approach to the learning process. What Access Health will intend to do is to enable this as its secretariat, provide some of the coordinating activity behind knowledge compilation, its processing, along with the technical facilitator volunteers from the members. Already we do have some of the facilitators undertaking the first 2 thematic areas under the learning process. With our presence in 3 regions of Asia, so the initial collaborative activity has begun from the Asian countries with representation from the other global regions as well. As you have seen, the presence in India covering the South Asia, as well as the Singapore presence to cover the Southeast Asia, and the Beijing presence to cover China and East Asia. So this enables us to support this collaborative platform, but ultimately the collaborative is intended to evolve in a self-organizing fashion. That means the members coming together, articulating how they would like to organize as it evolves into a perpetuating learning system. Similarly, the intent was to evolve into a self-governing system. So the members ultimately can group around the geographies. There may be national chapters or state chapters within a country, a large country. Some of the regional chapters in South Asia, and also the continental regions. So idea is to bring together people in a geographical fashion and then cross-pollinate ideas between the regions in a geographical fashion. The second governance organization is around the thematic subjects, because different members come from different areas of health systems with different focus interest. So idea is to bring together people and the departments and the institutions, both practitioners as well as the researchers, around certain thematic areas. Initial thematic areas that were conceptualized was in understanding how we actually assess our health systems in terms of its resilience. Because most of the health system assessment, we all familiar that we assess health systems in terms of normal times. However, this is the first time, and of course the preceding some of the crises that the health systems are facing. The health systems are not designed adequately to face health shocks and the health crisis like what we witnessed during the COVID. So most of the indicators of health systems around the building blocks have been designed for the normal state of affairs, but they're not designed for what happens when a shock happens. I mean, the human resources, so the supply chains, so the health financing, protection, the surveillance systems, and these are the systems which are designed for the normal times. So the imperative is to organize some of the members and the collaborative participants around the thematic areas, and then dive deep into each thematic area so that we become more wiser from these dialogues, the mutual reciprocal dialogues. The process of this compilation, my colleagues Girish and Maulik will be outlining. But in a brief, that's what I said, a self-organizing and self-governing system. And finally, it has to become self-sustainable. While the initial contribution, because as a collaborative, each of us, some of us are contributing through monetary contribution. For example, the Rockefeller Foundation provides the seed capital for this venture. We are expecting a similar financial contribution from different sectors different philanthropists and different who have the resources to support this activity. But more importantly, the time which is volunteered by the members in this learning process, and also the time and effort volunteered by the experts, both the individuals as well as the institutions, acting as facilitators or moderators or the teachers or the faculty or conveners of national chapters or the state chapters. So what it implies is to make it a collaborative spirit of volunteering the knowledge resources, the time resources, and the financial resources to make it self-sustainable. So these are the fundamental principles behind organizing this collaborative. And finally, what we intend to achieve, the whole purpose for which this shared purpose is that ultimately these learnings, how they translate into actions, the policies, actions, and strategies. And as a collaborative, how do we evaluate what impact these learnings are making on the health systems that we hail from and we represent at an institutional level or at a state system level or at a national system level. If we can bring a change and make systems more stronger and more resilient through this learning process, I think the objective, the founding objective of this collaborative would be achieved. So this is, I think, a brief introduction. I think as we go along and meet in person in due course of times during the quarterly meetings or the annual meetings, and also the focus group meetings, we'll be knowing each other well. And we hope collectively we make a difference to the world that we live in. With these few words, I hand over, thanks Srikanth for this opportunity for giving the introduction to the Global Learning Collaborative. And again, apologies for some of the technical glitches.
Thank you, Dr. Reddy, for outlining the principles and purpose of this particular collaborative. Now I would like to invite Mr. Girish to give a orientation on membership journey and how the whole collaborative is going to work, or how the members are going to participate in this particular collaborative. Over to you, Girish.
Thanks, Srikanth. And once again, welcome all to members for the Global Learning Collaborative. So I'll not take time because we have actually spent to a larger of our members while we had a brief introduction meetings where we went through the entire program and what it benefits. And that's how we see is that most of us are part of this platform. What I will try to really is to bring across the key aspects of this members and the benefits and how you can access those areas. I will just share the screen. Just give me a Can you see the screen?
Yes, it's visible.
Yeah. Now, as we go through the membership benefits, as we discussed largely and bit summarized by Dr. Reddy, few things which are keywords or key things reflected throughout our discussion in the last couple of months, right from the establishment of the Global Learning Collaborative. There are three keywords which have been repeatedly used. One is impact, second is learning, and third is collaboration. I think these are three important aspects as a member of what we are actually trying to see, how we can really integrate this smooth flowing functions. At the end, the outcomes obviously is the impact what we see, but how well we can talk to each other, coordinate, and also share is, I think, some of the important things from a learning aspect and collaborations. While they've been Access have been a part of the GLN network in the past, establishing these collaborative networks and bringing some of that experience over here. That's one of the reasons what Dr. Reddy has summarized. One, obviously, is the shared purpose of what we're doing, and all of you are putting up your time on a voluntary basis to really make an impact here. Secondly, is the learning process. So that is, I think, is the important piece which I want to stress today is that one is in the learning process. What we're looking at is, as we look at is, I'll just put this pointer. Yeah. So as you see is that one as a member, once you're in, one is you can be a technical facilitator. That is one. You can opt for to become a facilitator apart from just being a member and contribution. You can also contribute from a technical friend, as we have seen in the initial discussions from each one of you, where your interest or expertise lies, how you can actually bring that to the fore. So one is the technical facilitator, how you can bring across the themes, and as we go with more sub themes. Second is that we will have more opportunities as we move forward to be as speakers, researchers, advisors, and conveners, both at national level and country level or regional levels. This is something which would come up as we move forward, and have an interactive learning opportunities. How this I will stress as we go to the next slides, how we can bring in more learning opportunities through this platform. And most importantly, we also looked at the implementation level. So the members can look at how the learnings can be translated to actions. When we say, are there some pilots, are there some interesting ideas or concepts which we want to take into the ground and showcase some of those learnings and impacts. Now that is also an important thing as we look at into the members to look at. So we will, then the next is that we will have a speaker series where there could be remote trainings or information sharing, which could be posted periodically for all the members. We'll also have members-only webinars, both from internal experts as from external at a global level, to actually build some of the areas of learning or bring those aspects. That is one thing which we're looking at. We'll be able to share you a calendar of events of those aspects so that you know what's coming up and what will be. Yeah, as I said, there will be an invite for attending the learning workshops. And members can choose the workshop. It's a voluntary exercise, but as we see is that it is based on their interest areas or the specific thematics or the entire collaborative.
Sorry to interrupt, sir. There is a lot of background noise.
Just look at, give me a moment. Is it much better, Shrikant, now?
Yes. No,
yeah,
yes.
Yeah. Okay, fine. Yeah. So the last one what I was talking about is the invite for the attending the learning workshops. The next thing what we are really looking at is the knowledge portal, where already the login IDs and the passwords have been shared to all of you. We have built in the content in the knowledge portal, while Anuradha will take you detailed overview in the next presentation. But lastly is that this portal have access to repository of all the information what we have from 2000 onwards across thematic areas, and it gives a one-stop reference for all of us to look at, review, and then it helps into sharing or discussions further as we move forward. So this is a piece which I wanted to touch upon is the engagement activities, the different channels, what we can look at and facilitate. One is that we have a quarterly P2P peer-to-peer meeting, which happens on every quarterly level. While we have the independent thematic areas having these discussions or workshops or focus groups parallelly happening, but as a quarterly meet is something which we will do. And we will also have the members coordination where we can look at annual conferences, something which we are planning this year in the month of November, early December, largely on the annual conference. And one of the things is that I also want to articulate is as members, feel free, and the whole collaborative is self-governing, flexible, and open to ideas and suggestions so that our learning purpose and the engagement can become stronger, because this is the base what we're starting today. But as we proceed further, I think with all of your ideas and suggestions, they can become much more powerful and also can be integrated much better. Then the thing was obviously is the conference and presentation of papers, sessions, so on in the forum, and participation in the learning session. This is where, as I said, is that in the learning sessions, this could be series where in the thematic areas or at a larger level, we will try to get the speaker series and the learning sessions. And then we want from each of the countries and the members for this platform for sharing, you can bring in your own what we say islands of excellence, or some success stories or challenges each of the country and how we would look at in each of your areas. Now, this could be put up as a publication or an article or a blog into the knowledge portal, and people can access. This is something what we're looking at as an ongoing process as we look into the engagement activities. And at the knowledge portal, what we have is they are user groups which are created across the thematic areas. That is where each thematic group, like in surveillance, there's a thematic area they can discuss among themselves. So we have 4 thematic areas, and more as we create more sub-themes, the user groups can interact with that. You can also have files, links which can be shared in the form of an information exchange. And then you can have a general discussion forum for all the groups for having discussions. So we have 2 aspects, an overall discussion forum for all the members and a very specific thematic area. So both sides, the learning can happen and exchange can happen, but the idea is to give you a platform where people, members, each one of you can discuss. Then we are also now testing this mobile application right now, and hopefully in a couple of weeks, we should be able to share with you. We are able to create a simple mobile app, both for Android and iOS for Apple. What we're looking at is that rather than coming to the portal each and every time through the app, you can use to connect with the members in the chosen network. You can do that. You'll get a notification of messages of what's happening. And you can also look at the knowledge portal in terms of what's happening in terms of knowledge products, or what are the activities happening there. So this becomes more user-friendly, and exchange of thoughts or information could be much more smoother as we are used to the apps now. So this is something which we are now moving from the web portal, what we have, to mobile applications. So this is coming up. And then, as I said earlier, as an open and a flexible organization, as Access Secretariat trying to coordinate and bring these things across, all your suggestions, any ideas or anything you want to ask, please write to this email ID, members@glc4hsr.org anytime, and we should be able to respond to you on that. That's all from my end, just to give a brief intro on the membership benefits and the learning journey. Thank you once again for all of you joining today, and we are hoping that we'll be able to do real good collaborative and also an impact. Thank you very much. Over to Sri.
Thank you, Girish, for taking all the members through the members journey and what they can expect from this collaborative and how the journey is going to be. Now I would like to request Mr. Maulik Chokshi to take the members through the learning journey process. Yeah, over to you, Maulik.
Thank you very much, Srikanth. So I'll try to be quick for the simple reason a lot of things have already been shared earlier. So as Dr. Reddy and Girish has mentioned, that this is a learning collaborative, and what we intend to do is to learn together, right? At the moment, Access Health has taken the role of secretariat, but we would like to co-create knowledge products, co-create opportunities for learning, and co-create a permanent access to members, the knowledge which has been created. So obviously, there is some process that we have thought right now. This is open to discussion, suggestions, as Girish said, that we will be happy to hear from you. So the steps obviously needs knowledge pooling, processing, learning, and iterative processes. So what we have thought is that the first step, and it's explained here, right? The first step is to identify the topic. We have currently 4 topics, and we started work on health system resilience. But as we evolve, I think so there is a process where we have got a technical advisory group which has been formed, which has got responsibility along with the members to identify which are the areas of focus. Because when you start talking about health system resilience, there are huge huge number of topics that needs a deep dive or needs learnings and sharing. But for us to prioritize, there is a group that kind of decides which areas we start focusing right now, and that's M1. M1 are timeline, but I'm just saying as a process also. Once the steering committee or the technical advisory group finalize that particular kind of topic, it goes to the member management process where we have got, when we reached out to it, when Girish and Srikanth reached out, we have also identified your areas of interest. So then within that network, we try to identify a technical coordinator who is ready to lead this entire development process, along with technical coordinator and a technical facilitator. So technical coordinator is something that who's going to kind of coordinate the process, and there is a facilitator who is a kind of a brain behind the behind this entire piece, the evaluation process, and they start working together and identify a group of colleagues, which we call here as SI group, it says special interest groups, and they start creating products which become knowledge product. Now, these we believe that these colleagues of the special interest groups are going to come from various countries representing out here, so we get diversity of knowledge coming in, and then they create an outline. What should be the content? What should be the contours? What could be the structure of the knowledge product? And the special interest group, which is going to be of 4 to 5 members, kind of take ownership of the particular knowledge product and start evolving or co-creating that. In the process, obviously, there is a larger ecosystem. They go out to other people, they reach out to other experts to get their opinion. And once a product is in the stage of finalization, it gets presented to the larger kind of member community. And that's what the learning journey kind of looks like as of now. In this process, when we interact with various kind of experts nationally and internationally, I'm sure there are certain countries who are going to kind of stand out in various aspects of health system resilience. Some might have done fantastic in terms of pandemic preparedness plan. Some might have done fantastic in use of digital in kind of responding to health system resilience. Some might have done fantastic in terms of healthcare financing responded to health system.
Maulik, you are not audible. Hello.
Country case studies would be created a group, which again becomes part of the, when they are ready, they reach out to the members who are part of the, and all these things. Hello.
Yeah, we lost you for like 10 seconds, Maulik. The voice was not clear. Last 10 seconds.
What was intended to say that these are all iterative processes where the group comes together and co-create things. As Dr. Reddy mentioned, we have started with health system resilience to understand the broad contours of health system resilience. But the current thematic areas which are kind of in pipeline are surveillance, and a couple of members are already reached out to see that how the surveillance piece evolves. And this is how surveillance and pandemic preparedness comes up. And we keep on evolving both at the thematic level as well as within thematic level. This is how the learning journey happens for us. There, in kind of past technical advisory group meeting, there were certain other emerging areas like financial resilience, digital surveillance, and genomic surveillance, which has kind of come up. We haven't started any work, or there are no kind of technical facilitators or coordinators or special interest group on these areas. But we would reach out to you colleagues, and we would like to work with you together to co-create this structure so that eventually it kind of defines the name is Global Learning Collaborative for Health System Resilience. So I will pause now. If there are any burning questions, I'd like to answer. Otherwise, I'll hand it back to Srikanth. Thank you.
Thank you, Maulik, for the making it very quick and taking all the members through the learning journey. If there are any questions, maybe people can raise their hand or maybe put it in a chat box. We have anyways kept one slot for question and answer as well. But if anyone has any questions now, maybe ask. Yeah, if not, I will like, yeah, maybe now, if not, I would like to hand it over to Dr. Anuradha. She will be taking all the members very quickly through the members portal and our website. Over to you, Anuradha.
Thank you, Shrikant. And as it has been rightly mentioned by the speakers preceding me, this is a collaborative which will be owned by the members. And before I start talking about the knowledge portal, I'd like to understand from all of you, also because you have so many years of experience and have been a part of different collaboratives, what would you expect out of such a collaborative? So we have kept a very short poll, and I would request you all to participate. Kindly let me know, Shrikant, when the poll is launched.
Yeah, it
The
is.
question is that it's launched.
Yes, yes.
So the first question, we'd like to understand that what are your expectations from a knowledge portal of such a global learning collaborative? What all should be included, and what would you expect to be a part of this knowledge portal? So it's on your screens, and I would request you all to give us your opinion. We're almost there now. Yeah. And just to tell you, this is a multiple choice question, so you can choose as many as applicable. So I forgot to mention that in the poll. I'm so sorry, Dr. Archisman. Can I probably share the screen, and you can probably have a look at.
I'm just texting you my responses. Is that okay? I'll type in the chat.
Sure, Dr. Archisman. I will, yes, we are done. I will end the poll and share the results. So are the results visible to the colleagues and the members? Yes. So 76% of you have spoken about the fact that we should have small user groups, which Girish spoke about.
Disturbing Anuradha, we are not able to see your screen.
Okay. So are the results visible now?
No, Anuradha, we can see a presentation.
It is coming out as a separate pop-up window.
It will come out as a separate pop-up. Yeah, that's what I wanted to say. That nevertheless, the question we asked was that what would you like to see as a part of this particular knowledge portal? And most of you feel that smaller user groups for ideation is something which you would look forward to. And also the fact that the group would like more email notifications to lesser intrusive in-app notifications is something which we have learned from this particular initiative. Right now, we have been focusing a lot on the curated articles, and more than that, I think the cross-learning and the reciprocal learning is something which you all are looking forward to. So thank you so much for sharing this poll. With these ideas, I'll go over the knowledge portal fairly quickly. So I hope the presentation is also visible.
Yes.
Thank you, Stuti. So there are two key objectives of this knowledge portal. One is the retrospective knowledge, the curated articles, the different papers, which will be available to you as members of this particular collaborative. And the second is the prospective knowledge, which we all create as a group in the form of a repository. And the articles like Shrikant mentioned that we have been working on health systems resilience, and those particular collaterals would be available to you for your discussion and debate. So that's what we are envisaging in the long run. We have a particular vision. We have a couple of things in mind which should be there on this knowledge portal. Again, it's iterative, as it was probably emphasized by the speakers earlier. The first is obviously to be an exhaustive repository of different articles, different case studies, different manuals, different development sector papers, and also most importantly, government documents on health system resilience. So if I would say what is our USP, one is obviously the curated articles, but also the articles or the papers related to say government manuals or papers say by WHO or even papers by allied entities of UN like UNESCAP. We have been seeing that they have been speaking a lot about digital resilience. So those papers would be available on this particular portal. And online learning sessions, we heard from our colleagues Shrikant and Chilshu that they would be working on the learning journey. So online learning sessions and conversations in the form of one, the discussion forums. Now the discussion forums is something like a large group where all the members are present. Often what happens in these large groups, and as you would have all encountered during WhatsApp conversations also, is that some information gets lost. So you could create smaller user groups for say financial resilience, like financial resilience, as Maulik mentioned, is one of the themes. You could create a smaller group and start discussing a paper which could be envisioned in the future. You could reach out to us for the support. And finally, access to this particular, as we're seeing, this is a closed group meeting. Currently, the vision is that this knowledge and learning portal would be for members only. But again, this is also for discussion. What can we have as multiple layers? What could be for the members? What could be for the public? So that's also, we're also in the process of thinking about that. This is the link to the knowledge portal, GLC4HSR.org, a fairly simple link. Once you click that link, you land on this page. We call it a landing page. And you see these different tabs on the page. I'll just quickly run you through these tabs and I would request you to go through them. The first is the context. Dr. Reddy spoke a lot about the context. Why is it so relevant to have this particular collaborative right now? The second is the design. What are the elements of the design? The members are the element of the design. Reciprocal learning is a part of the design. That's what we discuss here. Then the learning process. What is the process of the pedagogy? Maulik touched upon the learning process and that's evolving, but we have that vision in our mind right now. Some of the themes which we envisaged, and again, a lot of themes have been emerging over a period of time. The team, the secretariat who's present on this call, we also have a technical advisory group. They would also be out there. You can reach out to them for learning on various themes. Resources, the knowledge portal. I'll just quickly run through the knowledge portal after this slide. News and events would be the details of any upcoming events. Now, the proceedings of this particular event and our launch, which happened a couple of months, 2 months back, are available on our portal. So you can read what were the proceedings, what did we discuss, who were the participants, you could reach out to them. So that's the idea, that all our upcoming events and the past events would be posted. And finally, the most important thing as members is the members portal. When you click on this particular tab, you land into the login page. Once you log in, you enter this members portal, which is somewhat like a repository. Now, how this repository is organized, this is the schema of the repository. One is the thematic areas. We start with we have started with 4 thematic areas. They are evolving. But against each thematic area, we have been in consultation with a lot of experts mapping sub-thematic areas. Like, for example, health systems resilience currently for us is probably a construct of the health systems building blocks of WHO. But in addition to that, there are a lot of other elements which we have been seeing, like saving lives, livelihoods, operational coordination. So these sub-thematic areas are actually growing. Then there are 3 other nodes which you see. One is about the paper. Search can be done via the authors, the organizational affiliation of these authors. Now, geographic applicability, are these global papers or are these country-specific papers? And the source, there are two sources, as I mentioned earlier. One is the retrospective article in the form of the curated papers. And obviously is the prospective knowledge which we would be generating as a group. That would also be available here. This is how it looks currently. You can select some of the thematic areas and look at the curated articles which are present. It's work in progress. However, I'd also like to show you the learning platform, the learning management platform, which we are creating. It's called learnera.org. And the forum is evolving, but it's here. You can enable conversations with the larger group here. We're also planning to have these user groups. Just a second. Now, a user group, as I mentioned, is a smaller group. We have 2 user groups currently, where we sort of communicate and talk to each other and share some ideas. So this is how we have been talking currently, sharing some articles, sharing some videos. So this is the smaller group which can be formed so that a lot of, there'll be a lot of noise, obviously, and some information may be lost because of that. So that's the reason why we have formed these smaller groups also. Back to the presentation, again, another poll. So thank you so much. There will be a question and answer session. However, we'd encourage you to ask any questions. So I'll launch the second poll, which is probably a very open-ended question I have here is, what have we missed? We spoke a lot about a lot of things, but maybe we have missed something. So just give me another a couple of seconds perhaps, and kindly let me know when the poll is launched. Maybe a +1 when the poll is launched.
It's launched.
Yeah, thank you. We can see it now. Thank you so much. And take your time, and we really need your inputs at this particular juncture. Some of the colleagues have mentioned in the chat box that they are not able to see the see this particular poll. Is that the case? Then I can read out the question and probably you can type the, I will type the question in the chat. I've typed the questions. If you're not able to see the poll, I would kindly request you to type in the answer in the chat box.
Anuradha, we are really running behind the time. Anuradha, if you can just make
Okay,
it.
we have 30% participation because this is an important question. I can skip
Yes,
the
yes,
next
definitely.
question. Yeah, this is an important question. I can definitely skip the next one, and we can. Would you like me to invite the next speaker in the internet?
Yes, yes, please. I guess that will be better.
Okay. I kindly request Dr. Uma Isola, our Director, Communications and Relations and Alliances, to please take over from here and talk about another important activity, the events of the GLC4HSR. Over to you, Dr. Uma. Thank you so much.
Thank you, Anuradha. And I am not going to take long, seriously, because I neither will present slides nor will I give you a lot of detail, because you will keep getting to hear about what we are doing as we go along on a very, very regular basis. Please keep looking out into your mailboxes for all the events and whatever we will keep sharing with you, so that we'll try and keep it as much as we can ahead of time, so that you can block those calendars well in advance for us to be all cohesive enough to take on as a group. And I looked at what I wanted to say about an event, and it felt that events are something that happen, especially when something important or unusual needs to be communicated. And I don't think we have anything more important than the pandemic that has hit us on the last, what happened 100 years ago was not documented. And if we lose that opportunity to document now and make sure that these events are well populated, well attended, and well aligned, we will again lose the opportunity to give our learnings to the next few years and see whatever we can do to prevent pandemics. The focus and how we want to go about it is every quarter we definitely will have an event, and we will have an annual event, as Girish has already pointed out. And then based on the interest of the groups, as Maulik has already said, we are going to have smaller roundtables, focus group discussions, individual discussions, one-on-one, where people feel that they need to share something with us. They can always reach out, set a calendar and work on it. We can look at expert opinions, which will keep happening from time to time, because everybody who is here is an expert of a different sort. And each of them will come together to be able to give more to us, to create the repository and the knowledge management that we will so richly share with the global collaborative as we go forward. The technical advisory group will also keep seeking us out from time to time and look at how we can support the papers and the policy discussions that will go forward. Having said this, no collaborative is good, and it's only as good as its members. And the events are only as good as the attendance. So we'd like to thank you very much. Of course, there'll be a formal vote of thanks for making sure that you attended this event, and also look forward to your continued participation and support to make this a very richly developed, participative collaborative. Thank you, Anuradha, and over to you.
Thank you, Dr. Uma. At this point, we'd like to take any questions, either in the chat box, or we'd be happy to take the questions if you raise your hand. You can also mention whom is this question directed to. I request Girish to take over the Q&A round. Thank you so much.
Yeah, I'll pass on to Srikanth. There's some background noise at my place. Over to Srikanth.
Sure. So we are open to questions. If any of the member have any questions for Dr. Reddy, Girish, for Maulik, for anyone, or overall regarding any of the slides presented till now or the journeys presented till now. Yeah, so there is a question from Dr. Deepak Raut. Are we open to include more new members in near future? I would like to direct this question to Dr. Reddy, please.
Yeah, Shrikant, as I mentioned, I mean, this is just the beginning of joining of the members. Ideally, I mean, each country will be represented by the governmental departments representing the providers, the payers, the public health, health information systems, and the policy making. Similar academic institutions with focus on each of these areas will also be invited to be the members of this. In addition to this, civil societies, because ultimately the feedback from the civil society is equally important because their health needs have to be met. Then fourthly, the funders, because we are reaching out to different international development agencies, how they can also partner in this collaborative effort. And the practitioners who are going to actually test some of these learnings in pilots. So this is just a beginning. I think the group is expected to expand. Initially, this is started from Asian countries. But however, the intent is to, as we go forward, to extend to the other regions of the world, especially the global South, Africa and Latin America and South Americas. So yeah, this is just the beginning. Answering this question, we hope that it reaches a good size, a good representation, a good cross-pollination of ideas and the knowings. So this is the intent here.
Thank you, sir. Thank you for the answer. Any other questions? Anyone wants to speak on what has been shared till now? Yeah.
There is a question for Maulik, Shrikant.
Yeah, I think from again, Dr. Deepak Rao is asking, thanks, Dr. Krishna Reddy, for entire team initiative. Okay.
No, there is a question from Dr. Santosh Sharma.
Okay, I missed it. Sorry. Thanks, Anuradha. For the learning process, does it have to be novel research topics, mean specially for GLC, or we discuss our research if it is related to health system resilience, or even discussion based on the news or the new government? So government policies. I think, yeah, it's rightly directed towards Maulik. Over to you, Maulik.
Thanks for the question. I think so. The facilitators group kind of discusses all the topics which are related to health system resilience, and they collaboratively decides on the areas, whether it's new government policies or new research. So technically, the group is open to discuss everything as far as it is aiming towards collaborative learning towards health system resilience. So there is no jacketed. But what I meant when I say priority is that if we are talking about financial resilience, that's a broad ambit. Within financial resilience, government policies, new research, everything come. But the priority then is at a broader level. Within that, everything is open. And members can decide adding new topics, which collectively we can agree on focusing as we evolve. Thank you.
Thank you, Dr. Maulik, for the response. If there are no more questions, I would just like to request every member to kindly mark GLC4HSR domain as not spam. I have already put this in chat box as well, and kindly access our knowledge portal, which has been shown by Dr. Anuradha. And if there are any troubles, you can always get back to the members' email ID. Which has been showcased by Girish presentation. I will text that one as well. And if there are no more questions, I would like to hand it over to Vinod for vote of thanks, please.
Thank you, Shrikant and Anuradha. Good evening, all. On behalf of GLC Secretariat, we are so glad that you all have attended the Global Learning Collaborative, the first members meeting. Thank you for your support by attending this meeting and for contributing for the event. And we would like to express our gratitude for your willingness to take part as an expert members of this Global Learning Collaborative for Health System Resilience. So your contribution will take a significant part in the collaborative. And also it was great knowing you all. Thank you for briefing about yourself and your experiences, your opinion, and also the feedback to our poll. So we are privileged to have the expert members from different parts of the world. So we are looking forward to your continuous support in making this collaboration a great success. And also we would like to thank you for letting us know about your interested thematic areas during our earlier discussions. And we hope that you all will have a great learning experience by sharing your thoughts and also receiving a beneficial information out of the Global Learning Collaborative. We will share you the minutes of meeting as for your reference. And we believe that your knowledge and also the experience will help and develop our respective thematic areas. And also I would like to thank all the speakers for briefing the expert members about this Global Learning Collaborative and also the learning journey and the various benefits which the members will be having, and about the knowledge portal, so which is very user friendly and which will have the complete knowledge of all the 4 thematic areas. And also thank you, Uma, for the explaining about the upcoming events. So I would like to thank even all my GLC Secretariat colleagues for their excellent support for making this event a very good success. So we look forward for your participation in our next meeting. Thank you and have a good evening.
With permission from Dr. Reddy, I would like to announce the meeting has been ended. So shall we close the meeting, Dr. Reddy? Thank you. Thank you, everyone. Thanks for joining us.
Thank you.
Thank you.
Thank you, everybody.
Thank you, sir.
Thank you.
Thank you.